One can actually think oneself into a healthy and a prosperous state. For positive attitude, produce and promote positive health. Welcome to Vivid View program. I am Ahilis, your host. Vivid View.
Say and do it.
Moving forward, the topic for our discussion today is the implication of abortion. Abortion is the act of terminating pregnancy either by miscarriage or induced, which can also be regarded as deliberate. The guests will be introduced shortly after this break. Please stay with us. Vivid View.
Say and do it.
Vivid View.
Welcome back. For the benefit of those just coming in, the topic has already been introduced as the implication of abortion. And with me in the studio today is a medical personnel. Let's make welcome Dr. Nonyenum Mary Jane Ofulue to the studio.
Vivid View.
Say and do it.
Welcome. Before we continue proper, please follow us on our social media as displayed on the screen. Doctor, you're welcome again. Please, you have had me define or try to talk about what abortion is. Do you still have more things to add to that?
Oh yes, I have so much to add to that as a medical personnel.
Yeah.
Because we come in contact with patients who frequently and regularly come in to have such procedures done. And so before we move on, I will just quickly talk about the definition of abortion, the various types we have, as well as some causes of abortion, before we move on to the implications, which we also call the complications of abortion. So what is actually abortion? Abortion is actually the act of either expulsion or extraction of all or parts of a product of conception. Sorry. I said all or parts of product of conception because some cases, some patients come in with parts still retaining and parts already expelled out. So it's either the extraction or expulsion of parts or all of the product of conception without an identifiable fetus or with a fetus dead or alive weighing less than 500 grams. So it's either two ways. We have an identifiable fetus or we do not have an identifiable fetus. This identifiable fetus can either be dead or alive. But the key point here is that for us to say that this is an abortus, the weight of the fetus should be less than 500 grams. Okay. So quickly moving on to the types, we have various types of abortion. And I will start with the common ones, which we call the spontaneous abortion. Spontaneous abortion is actually the passage of pregnancy before 20 weeks of gestation. It's important before 20 weeks of gestation because after 20 weeks, it is termed another term called stillbirth. And so once it's before 20 weeks of gestation, it's actually abortion. Spontaneous abortion is also called miscarriage, which everyone knows about. Yeah. And then we also have another type of abortion, which we call the threatened abortion. The threatened abortion is actually bleeding of intrauterine origin. I will stress on the point intrauterine. It has to be coming from the uterus for us to say that this is actually an abortion. So it's bleeding of intrauterine origin that is before 20 weeks of gestation.
20 weeks is very invariably 5 months, about 5 months.
About 5 months. Yeah. And that is actually the benchmark for all of this.
Okay.
So it's before 20 weeks of gestation. With or without uterine contraction. Uterine contraction, I mean the abdominal cramps that these women come in with. So I said with or without uterine contraction, but, I stress on it, but without dilatation of the cervix. I'm sure everyone knows what we call cervix because, cervix is just like a passageway to the uterus. Yeah. So for anything to pass out from the uterus, the cervix has to be dilated. And so from the name threatened, just the ordinary meaning of threatened means it's something that's it's about to happen, but not really going to happen. So there's no dilatation of the
so
cervix.
At that stage, could be prevented somehow if we were treated.
Once there is no dilatation of the cervix, the fetus or the embryo will not be able to pass out. So it's without dilatation of the cervix and without the passage of the product of conception. That is what we call the threatened abortion.
Okay.
Then moving on to the complete abortion, from the word complete, meaning that the passage of all of the product of conception before 20 weeks of gestation. And then the incomplete abortion is the passage of part of the product of conception, meaning that some are still retained in utero. Then moving on to what we call the inevitable abortion, from the word inevitable, meaning that this must occur. There's no two way about it. It must occur. Sure. So this is actually bleeding of intrauterine origin, must be coming from the uterus again.
Of course, yeah.
With dilatation of the cervix. So now we are talking about with dilatation of the cervix. But if you remember when I talked about threatened abortion, I said without dilatation of the cervix. For any pregnancy to be carried to term, the cervix, once a pregnancy is confirmed, the cervix is actually closed to keep the fetus inside. And so once we have dilatation of the cervix occurring, then there's nothing we can do about that. That pregnancy would either, if it's to term, the baby would have to be born.
Okay.
But if it's not up to 10, that pregnancy would actually have to be miscarried. Once there's dilatation of the cervix. So inevitable means there's dilatation of the cervix, so the product of conception must be passed out. And then we have what we call the missed abortion. Here the fetus is already dead, but the product of conception is still retained in utero. So meaning that we missed it.
Yeah.
Because nothing was passed out, we didn't actually realize that, hey, this fetus is already dead. And then we have the septic abortion, which for me, I believe is actually a complication of the procedure because it's actually infection of the uterus and other surrounding organs closely related to the uterus. Of importance to note is that spontaneous abortion is the most common abortion that we have. In as much as we have other types that I have mentioned, but it's the most common. And majority of these abortions actually take place in the first trimester. And so as we go down the trimesters, the frequency decreases. That doesn't mean that it doesn't occur in second trimester or the third trimester, but majority of the time it occurs in the first trimesters. And so moving on to the etiology, the causes, what are the causes of abortion?
All right. Thank you so much. We'll take a break now. We'll come back. We'll continue. Vivid View.
Say and do it.
Vivid View.
Okay, I'll still allow you. We are going to the causes of abortion now.
When we talk about the causes or etiology of abortion, I said majority of abortion actually occurs in the first trimester. And first trimester abortions are as a result of genetic causes. We do not have any power over that. Either a problem with the chromosome of the developing fetus. So that is what actually causes majority of first trimester abortions. But we also have maternal factors that play a role in causing abortion. Maternal factors, for example, infections in the mother. So if a pregnant woman has infections such as gonorrhea, chlamydia, cytomegalovirus, herpes simplex, and so on and so forth, those infections can actually predispose the mother to abortion. Not only infections that can actually predispose...
Do you think the mother may know that she has such infections, or they could be there without her consent?
Some mothers, they actually do not know in our setting,
that's the issue.
because they do not go to hospitals to seek help for certain infections. And some of them, they don't even go for prenatal care. They're actually pregnant, they stay at home, and then by the time they are ready to deliver, they just go to a traditional birth attendant, and then that person takes their delivery, and that's all. So the child lacks prenatal care. The mother does not even go for checkup to make sure that everything is well with her, or the developing fetus is actually growing properly. And so most times
they will say lack of money. They don't have money to do that.
It's possible too. So it's only mainly those that have or that are well that are educated that can actually feel, oh, there's something wrong with me. I don't feel okay. I'm having this kind of discharge. I'm having this
kind of
wrong with
signs and all
me,
that.
stomach pain here and there, waist pain. And so because of all that, they find themselves in the hospital. But those in the rural areas that actually do not have this knowledge, they just believe, maybe it's part of the pregnancy for me to have such things happening to me. And so they retain the infection with them, still carrying the baby, and at the end of the day, this baby would come, you know, they might come down with abortion, a miscarriage of some sort.
Or even some kinds of deformity.
Yes, actually. And so that is the aspect of infections in the mother. We also have uterine causes. Uterine causes, I mean, some individuals during the development of the uterus, the normal architecture of the uterus was not fully developed. And so they come with abnormal shape of the uterus. The normal shape of the uterus is actually pear-shaped. And so we have individuals with different types of uterus. For example, we have the unicornate uterus, the bicornate uterus, arcuate uterus, septate uterus.
Wow.
And so those individuals with this type of deformity will actually not know, except if by the time maybe they get pregnant, and then during the routine antenatal visits, and the doctor says, okay, go for a scan and let's know how your baby is doing. And they eventually come up with, madam, you have a unicornate uterus. That does not mean that those individuals cannot get pregnant.
Okay.
But they're only prone to what? Abortions and miscarriages.
Okay.
So, the uterine factor. And then moving on to also, still in the uterine factor, we have what we call uterine scarring from maybe a previous abortion or a previous D&C. So these individuals, maybe they've had 2 or 3 abortions previously, and as a result of the procedure, there was scarring of the uterus. And that scarring of the uterus can eventually lead to these individuals having or being prone to miscarriages. Then moving on to the cervical factors. The cervical factor, we have what we call cervical incompetence. There are some individuals that their cervix cannot actually carry the weight of the baby. And that does not mean that they do not eventually deliver their baby or carry their baby to term. We have procedures that we do medically that once we come in contact with such individuals, we help them and then we will ensure that their baby is carried to term. So cervical incompetence is also a factor of or a predisposing factor for abortion. Also, toxic effects. Some toxins, such as some chemicals like lead, formaldehyde, alcohol also, and nicotine also can predispose a woman to abortions. Then we have the immunological factor. Immunological factor, I mean, related to the blood. There are some disorders that once a woman has, can predispose her to abortion. For example, the ABO incompatibility, blood group incompatibility. A woman and a baby might be of different blood group, and so this can actually predispose the woman to abortion. And then we also have the environmental factors, which I've already mentioned already, like the lead and nicotine and smoking
alcohol
and all that occurring as a factor for abortion. Malnutrition also. It is important that once a woman is pregnant, she takes adequate nutrition. The adequate nutrition ensures the growth of the baby and also helps to carry this baby to full maturity. And so when we have these individuals or these mothers that they are not even opportune to have a proper meal, not to talk about having a meal that would actually provide the necessary nutrients for the baby.
For the baby.
So these mothers, they are actually very prone to what? Miscarriages as well.
Wow.
So with all that, I think I will just stop there for now.
Thank you so much. You are just on point. You're just on point because I wanted to stop and say, let's have a break. So we'll take a break now. We'll continue. Vivid View.
Say and do it.
Vivid View.
Welcome back. Having enumerated all this in the courses and all that, is there any limitation, you know, on any woman or a lady to choose to elect an abortion? Is there any legal limitations?
There is actually no legal limitation to abortion, because in our setting, there might be a law passed, but it's not implemented.
Okay.
These individuals can go to a rural area to have their abortion done, and how do we know about it? So, in our setting, a woman can actually have as much abortion as possible that she chooses to have. And so, there's really nothing set aside to say, okay, this is it.
This is going to be penalty, for instance, for doing
for doing this and for doing that. I know majority of the time what happens is that these individuals don't come to the hospital that I want to have an abortion done. What they actually do is that they get it done somewhere else, and probably as a result of the complication, or there's no passage of, or there's partial passage of the product of conception, then they come to the hospital. And at that point, we have no reason not to do it. So we have to now evacuate the remaining product of conception just to save the life of the mother. But it's not something that is actually allowed for us to do in the hospital setting.
Except when there's that complication.
Except when there's a complication to the life of the mother.
Okay, so what are the health implications now to abortion?
With abortion, we have several complications that can actually arise from abortion. We have the minor complications, which after the procedure, the individuals, they come down with abdominal pain or cramping, and then they come also with minor bleeding or spotting, nausea, vomiting, diarrhea, and slight fever, just with the minor complication. But moving on to the major complications. For the major complication, these individuals, they come down with massive and severe hemorrhage, bleeding. Severe bleeding. They also come down with infection already going on. That is why most times, once those procedures are done in hospital setting, it is usually prescribed, or it is usual, or it's acceptable, or it is the role of the doctor to prescribe antibiotics to cover up for possible infections. But you know, some of these women, they go to quack doctors, or chemists by the roadside to have the procedure done, and so they do not have the antibiotic coverage, and so they end up having infections. But this, not knowing that these infections can actually lead to infertility if not properly treated. So infection is part of the complication of abortion. We also have the uterine complication, which is uterine perforation. Why do we have perforation of the uterus once abortion is done? Not that it is a must, but in some cases we have that occurring because abortion is actually a blind procedure. So if care is not properly taken, it can actually damage the uterus.
Can you explain that? That is a blind procedure. A
blind procedure in the sense that you do not know what is going on in there. You just, expose the woman, and then we put in our...
Wonderful.
VV.
For a normal pregnancy, once pregnancy is confirmed, the cervix is closed. But with abortion now, because the cervix is closed, we are trying to force it open to get into the uterus. And so by doing that, we can actually cause what? Incompetence of the cervix. By incompetence of the cervix, I mean the cervix no longer has that taut nature to close back.
Close up.
And so this cervix is now opened.
Wow.
And so with future pregnancies, this woman can now be predisposed to what? Miscarriages. And probably she wants that pregnancy by that time. And so by that time, she keeps losing and losing her children just because of that one procedure.
Yeah. Wow. But thank you so much. With my own little study too, the implications are grouped into three. So you have physiological, implication, psychological implication, and spiritual implication. That physiological implication is also what you have just even mentioned. That is the physical, like call it physical damage or injury, you know, like you mentioned now, that the woman could have in the process of doing this, process of miscarriage. And then psychologically, it had to do with emotion. Sometimes she would just be there thinking, oh, I shouldn't have done this. Why did they? Especially when she get married and start looking for baby are no longer coming. There's no way she will not cast her mind back, a kind of flashback. Ah, I did abortion, so many, either 1, 2, 3, or 4, whatever, how many times it could be. Now I'm looking for a child. Where is the child? And then the spiritual part of it, that at least we talk about God, either you're a Muslim or a Christian, we talk about God. And then that fear will be there. Oh, I've really offended God. How am I going to do it? How do I reconcile and all that? So it's a lot of implications, actually, when you talk about miscarriage. Thank you. That's my own contribution to what you have said, even as a layman. All right. Okay, we'll take another question. Are there health risks to a woman associated with, you know, various procedures? You have mentioned some of them, so maybe just continue from there.
There are really no, it doesn't matter the number of times that a patient has had an abortion, because the complications are there already. And so those that actually have maybe about 2 or 3 episodes of abortion.
Nari episode.
Vive, vive.